I became an orthopedist because it's one of the few areas of medicine, surgical medicine, that are constructive. You fix things, you don't throw things away. The other thing is that before I became an orthopedist, I'm old enough that the first letter I received when I graduated from medical school was report for your physical. You were going to go to Vietnam. And I chose, rather than do that, to do, again, something I thought was service to the country, but maybe more constructive. I joined the Indian Health Service and went up to Alaska, practiced family medicine for 2 years, and found out I didn't like treating belly aches. I really didn't like just a lot of things in medicine, but I really did like really focused problems. Somebody broke his arm, somebody broke his leg, somebody dislocated his shoulder. You can get your arms around a problem like that, and you can solve those to everybody's satisfaction. But back in 1982, when I got more interested in shoulders, there wasn't very many people that did shoulders, frankly, from a practical point of view. There wasn't a lot of things you could do for shoulders. But I was sort of in on the ground floor of arthroscoping shoulders, developed a technique to stabilize them arthroscopically. Up to that point, hadn't been done. And it just gave me a niche, and a niche that I was able to grow in, and my practice grew in, and by I was able to fill my time and my week with just shoulder problems, and it's sort of made me a shoulder person without even taking the fellowship. The fellowship came to me. I've been married for 42 years, and my wife and I came back to Omaha with one child, and now we have 3 children. We've bookended one boy with 2 girls, and they've been really the delight of our life. When we had our youngest child, she'd never go to bed at night until she wrenched out of me some kind of a story that I would tell her about when I was a little boy. And the only stories that seemed to come to mind were stories of vacations. So back in the early 90s, 1991 I think it was, my wife and I started taking our kids on over-the-top trips every year. And it's really been the cement, the glue, the bond that's really not only held our family together, but made my 3 kids close. Some of the trips that we took revolved around, I hate the word medical missions, but volunteer medical work in foreign medical countries. And it probably is somewhat instrumental in the fact that 2 of my 3 kids are doctors and one's a nurse. So I was asked the question, what else do I like to do outside of work? And that's a question that moves with age, isn't it? When I was younger, the answer would have been all sporting type of activities, whether it be biking, jogging, hiking, so on and so forth. As I get older, it moves more to the sedentary areas where the sporting activities fall to the wayside. And my involvement with my kids' athletics, especially my son's hockey, is something of memories of the past. But today, my wife and I are in a couples book club. We enjoy that. We still travel a great deal. I still, probably every year, and now even 2 or 3 times a year, do some foreign medical work. And my youngest, who's an operating room nurse, and is a travel nurse where you take junket jobs for 3 months at a time, frequently takes those trips with us. We went to Cambodia earlier this year, and early next year we're going to go to Burma and spend a few weeks there. Our group is a bit unusual insofar as it's always been successful, I think, based on a subtle camaraderie that really you rarely see, whether it be in medicine or any profession. When I first started, we were scattered over 6 hospitals. That's a lot of people and a lot of area to keep track of, and everybody did something so that the day's work got done, and it really took a lot of cooperation, a lot of trust, that everybody worked equally hard because everybody took home the same amount of money. As time's gone on, we've moved with medicine. Medicine's demanded greater specialization, and our group is one of the few groups that has been able to successfully categorize everybody into specific subspecialties and to stay busy within that subspecialty so we could provide the best care for the patients, and yet all seem like we're doing it, if you would, an equal amount of work. It's something that slowly dawned on me, but that type of cooperation and camaraderie you just don't see in many medical offices. And I know that from firsthand, not only from, I'm not talking about the Omaha community, just around the country. So the success of this office has been, of course, the fact that we've got good doctors who are dedicated to excel in some areas so that we could deliver the best care. But that care goes across from physician to physician too, and we take care of each other by making sure that we're all successful, because if one of my partners who's more of a hip person gets a shoulder problem, they send that person to me without worrying about who's getting paid for what. We just worry about the care of our patients.